Hi, my name is Peyton, and I'm going to be presenting on ACT UP, which stands for the AIDS Coalition to Unleash Power. In July of 1981, the New York Times would publish an article called Rare Cancer Seen in 41 Homosexuals about the disease that would later become known as AIDS. In the newspaper article, Lawrence Altman talks about the unknown disease and how it is rapidly killing the patients that are presenting with it. By the year 1987, the AIDS epidemic had killed almost 60,000 people worldwide, and more than 40,000 people were HIV positive in the United States. Many people accused the United States government of ignoring the global health emergency. President Ronald Reagan himself did not even say the word AIDS publicly until September of 1985. Larry Kramer, a gay rights activist, called for the formation of an AIDS activist group in his speech at the Lesbian and Gay Community Center in Manhattan in 1987. Shortly following, 300 people arrived for the establishment of ACT UP, the AIDS Coalition to Unleash Power. Their goal was to take direct action to end the AIDS crisis. ACT UP held its first protest on Wall Street. This protest was against the pharmaceutical companies that were profiting off of making the price of medication for AIDS extremely high. Specifically, ACT UP called for the release of life-saving drugs by the FDA, the availability of affordable medication, public education around the spread of HIV, and policies to end AIDS-related discrimination. Ann Northrop, an ACT UP organizer, said that their protests were always planned to be dramatic enough to capture public attention. Shortly after the Wall Street demonstration, the FDA announced it would shorten its drug removal process by 2 years. Key figures for ACT UP, the original 11, were Charles King, Tim Bailey, Ann Northrop, Eric Sawyer, Larry Kramer, Garance Frankie Ruta, Ron Goldman, Maxine Wolf, Robert Vasquez Pacheco, Peter Stanley, and lastly, Robert Garcia. All played different roles in the organization, but were vital to its success and activism. ACT UP would also utilize die-ins as a way of protesting. Protesters would simply lay down on the ground and pretend to be dead, and sometimes would cover themselves with signs or banners. ACT UP held thousands of die-ins across the country, but not all die-ins were fixated on the same issue. Die-ins led by ACT UP focused on the slow release of new drugs for AIDS, the narrow definition of AIDS, and drug prices. Die-ins were also not theoretical signs of death. In a demonstration known as Ashes Action, activists in D.C. carried the ashes and bone chips of loved ones who had died of AIDS and dispersed them on the White House lawn. Some even carried corpses that were in open-faced coffins. And they did this because they believed that the severity of the problem was not coming across. ACT UP was one of the first groups to propose designing healthcare solutions based on the population that needed treatment. They treated underserved people with AIDS, found shelter for those who were unhoused, and protected IV drug users through needle exchanges. ACT UP challenged the healthcare industry as a whole. They fought for changes in state insurance laws and called out policies that excluded gay men. ACT UP also played a vital role in pushing government agencies and drug companies to accelerate their testing process, lower costs of drugs, and bring people with AIDS into the care design process. ACT UP really brought the idea of patient-centered care to life. Dr. Anthony Fauci further proposed this by saying, before AIDS and before ACT UP, all experimental medical decisions were made by physicians. ACT UP put medical treatment in the hands of patients and that is the way it ought to be. ACT UP is still active today and still fights to find a global cure for AIDS and to assist those who have received a diagnosis.